Hello, everyone. My name is Brent Garvin, Senior Product Manager for Imaging for Plan Mecca USA, and we are so delighted to have you here this evening. We have some really awesome guests tonight, but before we get started and introduce everybody that's with us today, I wanted to go over some housekeeping stuff for this CE course that we have for you tonight. So as far as CEs, we have one CE for you tonight. One of our speakers is an employee of Plan Mecca, and the other one is a guest, and neither one of them are compensated directly for tonight's CE that's being provided. So as far as CEs, Plan Mecca offers a lot of CEs on their website, which is planmecca.com. That's PLANMECA.com. So if you visit there, you'll see hopefully on our homepage that you can join many of our webinars that we offer. To give you an idea of what's coming up next Friday, June 19th at 3 p.m. Central, we have digital occlusion and 4D mandibular dynamics in implant dentistry. Dr. Dorniez will be joining us for a fantastic 1-hour CE as well. And then if you are available on Wednesday, June 24 at 6 p.m. Central, I will be hosting a Learn to Fly event for those that want to take a deeper dive into 3D imaging and 3D imaging software. So we'll go through some scans and have a nice time spending an hour going over 3D imaging. And then next week will be part 2 of this series, Friday, June 26th at 12 noon Central. We're going to talk about how to modify your existing sterilization area. So if you have a sterilization area that's that you want to make some modifications to from the things that you're going to learn tonight, plus the things you'll learn next week, we're going to be here to help you with that. So if we can go ahead and get started now, I'd like to introduce you to 2 fabulous individuals. We have Annie Roy. She is the General Manager of Triangle, which is the cabinetry line division of Plan Mecca. And she's also the product manager for all core equipment for Plan Mecca USA. So we welcome her. And then also we have an old friend of mine, Doug Brenly, who is the senior product manager. Him and I go way, way back. And I looked at your resume there, and I probably shouldn't disclose your age, Doug, but it looked like back in 75 or something like that, that you got into dental.
I'm a geezer. Yep, absolutely.
Well, that means he's full of a wealth of knowledge. So we're excited.
That's it. And when you work for a company for 26 years, you kind of just through osmosis, you just kind of know some stuff.
Yeah. And if I didn't mention Doug is from SciCan, which is the industry leading infection control experts. And if you need to know anything about infection control, there's nobody better than Doug Brenly and fine people over at SciCan. And so we're excited that they're joining us to help us out. You know, we're going to be talking about COVID today. That's the big topic. Not that things have changed in sterilization regarding COVID, but I think it's drawn attention to this topic. It's elevated the importance of this category. And so we are very excited for tonight. So how things are going to proceed from here is at the bottom of your screen is a chat section. We're going to reserve that for any technical things that are going on. So if you do have a technical issue or something like that, feel free to use chat for that. We're going to reserve the Q&A section, obviously, for questions and answers. So if you want to type in a question during the program, please feel free. We'll monitor it. If it's something related to what's going on, I'll gladly type a response to you. I might even ask the speaker to take a pause and address that question, because they won't see those questions as they come up. Otherwise, we'll save all of the other questions for the very end at the conclusion. And at that time, we'll handle Q&A and we'll provide that 1 CE link that you deserve, and as well as the course code. So let's get out of the way and bring Annie to the table here, and welcome Annie and Doug. Thank you for being here.
Thank you very much, Brent. So a quick history about sterilization area. Maybe some of you know this, but the first Steri Center dedicated to the dental industry was introduced already 30 years ago almost in 1991 by a company called Triangle Furniture Systems, which is now part of the Planmica group. So at the time, it was the first time that all the recirculation procedure and guidelines and recommendation were translated into a product that became the standard in the industry. So infection control, as Brent was mentioning, is in everybody's mind today because of that COVID situation, but it really hasn't changed. The procedure have not changed. The protocols and aseptic techniques have not changed. What have changed is the patient's awareness, but also the treatment provider awareness. So what we're gonna do today is go through all the steps that we already know, but we're gonna go in details on the why each step of the recirculation procedure has to be performed, how to perform it, and we're gonna give you a few tips and advice along the way. So I will present each step one by one, and I will ask Doug to provide some information along the way in some specific topics. So let's start with all those step-by-step instrument recirculation protocol from soiled to clean. So of course we start with soiled item coming from the treatment room. We all know that the sterilization area should be centrally located, easily accessible by all dental staff, and instruments, soiled instrument from the treatment room to the sterilization area should be handled in a manner that minimizes exposure to the person and the environment. So puncture resistant glove that we call utility glove are recommended for handling potentially contaminated instruments. You also need to wear protective mask and full PPE when handling soiled instruments. Between the treatment room and the sterilization area, use a closed container. So use any container you have with a lid is preferred to limit any aerosol spreading in the environment. So it could be a tub with a cover, it could be a container that you have with a cover, but always use the PPE, the utility gloves, and all the required PPE. If you get to the sterilization area and you don't have time to handle those instruments right away, you can have a temporary soiled storage to store those items until you have time to process them. Of course, it's ideal to process as soon as possible. When you get to the sterile center, you're wearing utility gloves. You're gonna scrub the instruments if needed. Then you're gonna wash your hands wearing those utility gloves. So you're gonna clean the utility gloves by doing so. Keep those utility gloves and the cleaning brushes, if you have some, in an area which is accessible easily and quickly by the other member of the team. Then wash hands and always use no-touch techniques. No-touch techniques for water, soap, tissue, and gloves. Then when you do have time to manage, when you come to the sterile center and you have time to manage those instruments, then you may have things to discard, regulated and non-regulated waste. Recommendations and regulations in this case is saying that contaminated sharps shall be placed in appropriate containers as soon as possible. This means ideally in the treatment room, but it may happen that you get some at the sterile center. So you should have a backup regulated waste container at the sterile center, and again, use hands-free access to those disposable regulated containers. For both regulated and non-regulated, you should always use hands-free and no-touch access. Pre-soaking. So pre-soaking is recognized as an important step to prevent drying of patient materials when you don't have time to handle those instruments right away. Using an ultrasonic cleaner or a dental washer, if you come to the Steri Center and if those equipment are running, if the cycle is in function, you should never stop a cycle. If you do add something to the ultrasonic cleaner, it means that you would need to start that cycle again. So if the equipment is in function, you should pre-soak or use enzymatic spray to prevent drying of patient material. So keep instruments in holding solution until time is available for full cleaning. If you use a spray, you can keep those instruments in a liquid or in waterproof drawers or in a waterproof storage. If you're using any liquid into a container, a drawer, or a basin, you should drain the solution and clean the basins daily or following the manufacturer's recommendations. For loose instruments, ideally, you should try to use a transfer basket, which will avoid handling sharp instruments that are still potentially contaminated. Again, puncture-resistant gloves should be used to transfer instruments from pre-soaking to the ultrasonic cleaning or to the dental washer. So cleaning to remove blood, saliva, tissue, and other complex proteins that may interfere with the disinfection and sterilization process. Ultrasonic cleaners should be installed on a pull-out surface to ease surface disinfection of the equipment itself and all around, and to ease maintenance. Like I said earlier, never interrupt ultrasonic cycles. Place instruments in the pre-soaking basin instead, or use temporary salt storage if time does not allow for ultrasonic cleaner at that time. If you're using a thermal disinfector or a dental washer, then a smaller tank size ultrasonic cleaner is still recommended as a backup procedure for the items that are not suitable with the washer or as a backup. And test the quality and performance of your ultrasonic cleaner using aluminum foil. Doug, do you recommend testing the performance of the ultrasonic cleaner on a regular basis?
Yeah, I would recommend doing that test once a month because unfortunately what happens with everybody's ultrasonic cleaner, if you have a transducer, some smaller units have one transducer, a lot of the medium to larger size will have two or more. And what will happen is, should you experience any issues where a transducer goes down, it doesn't sound any different, it doesn't feel any different, but one of the transducers is not operating. So if you see in those pictures yet, we will have, by the time you dip a piece of regular, not the heavy duty, but the regular aluminum foil in, and you can hold it with your fingers. I would leave it in there for a period of 1 minute. And when you remove it from 1 minute, you should have equal holes or dimpling all the way across the piece. I don't want it touching the bottom or the sides, just kind of hold it in the middle of the tank. And should you have a transducer that's not working, what you will find is you'll have holes and dimpling on one side, and the other side, it'll be perfectly smooth. That's screaming at you that you have a transducer that's broken. So it's time to call the dental dealer and see if we can get that fixed, because if you're using double-ended instruments, those instruments on that side are really not getting clean. They're just kind of jiggling around in dirty water.
Thank you, Doug. So if you have the possibility of adding a high volume evacuator or suction line in the sterilization, in the Steri Center, it might be useful to clean, empty the basins, clean around the ultrasonic. So that might be a good thing to add to your sterilization area. Rinsing, so after cleaning in the ultrasonic, you need to remove debris, microorganism, detergent, or residual cleaning solution. So again, you wear those utility gloves, you wear a protective mask, you're careful to avoid splashing, using hands-free technique if possible with a water foot control. But again, if you're using a thermal disinfector or a dental washer, you do not need to rinse the instruments. After rinsing, you need to dry those instruments because wetness of instruments can interfere with all sterilization methods. So drying also extends useful life of instruments by preventing corrosion, rusting, dulling, and sputting. It makes handling instruments more comfortable and it prevents rupture of paper wrap. If you're using a dental washer, you do not need to rinse and you do not need to dry. But if you're using a standard ultrasonic cleaner, it is recommended to integrate an instrument dryer in the Stericentre. If you have an instrument dryer, of course, they should be compatible with the instruments cassette or any of the transfer baskets that you are using between the pre-soaking, the cleaning, and the rinsing, again, to avoid handling. After drying, sorry, not after drying, but if you're using a dental washer, and this is where I will defer to Doug to talk about that. So cleaning, rinsing, and drying can be combined in one step. So it saves time, obviously. So by using a dental washer, why would you recommend a dental washer, Doug?
Well, one of the things is because when you have ultrasonic cleaning, the whole thing, we always talk about the overhead in a dental office being around 30% for personnel. So now you have a hired dental assistant basically doing dishes, having her rinsing things, having her washing things, having her or he rinse the things afterwards, making sure everything is dry and then moving them on. It just is tick, 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 more time, more time, more time. We want to be as efficient as possible so we can load up a washer, hit the button, walk away, do more things that are productive. It'll get washed. It'll get rinsed first, then it'll get washed, then it'll get rinsed for a final time and then dried. So when you open up the door, all the instruments, all the cassettes are dry and ready to go. And Annie was exactly right. Wet instruments going into anybody's sterilizer, we kind of have a rule of thumb, especially if it's a pouch. Wet pouches going in is going to get you wet pouches going out of a sterilizer. And all of us in the sterilizer business, we have an approximate idea as to how long it takes our own machines to complete adequate drying. That can be off as much as 10 or more minutes just if you introduce wet pouches going into the sterilization cycle. So she's 100% on the ball, dry going in, and you'll be dry coming out of a sterilizer.
And what's the typical cycle time of a dental washer?
Yeah, a typical cycle time for a washer is going to be about 40 minutes. Can be a little bit faster, or if you have complicated loads and you do this as a matter of routine, you can actually increase the drying time. Particular one that I'm very familiar with, it's going to have about a half-hour wash time, about a 10-minute dry time. So that brings us out to the 40 minutes. Okay, very good. So if you're using an ultrasonic cleaner, of course, it's going to take a little bit more time. It's going to work. You're going to get instruments clean, but it's like a 20-minute cycle time for the ultrasonic. Then you need to rinse manually. And instrument dryer, they usually run for about 15 minutes. So right there, I mean, it's equal in time, but it's a lot less handling. So you don't have to be there at that Stericentre to handle those instruments that are, again, potentially contaminated. So you want to avoid handling those instruments, and that's why dental washers are a big advantage in a clinic setting. Lubricating, one of the mistakes we see often is that where do we put that lubricating equipment? Is it a soiled? Is it a clean item? Well, it's definitely a soiled equipment, and it should be on the soiled side. So usually we recommend to put that right next to the cleaner or the dental washer, next to the sink, soiled sink, prior to wrapping and prior to autoclaving. Wrapping, so why to wrap? Well, I think everybody knows, to protect items and maintain their sterility. Instrument that will not be used immediately should be packaged before sterilization. Is there still some state where wrapping is not a
a regulation? Do you know that?
No, wrapping is pretty universal all across the United States. As Annie and I talked about before, there is CDC just makes recommendations. It's not enforceable. So the way it works is the states, the individual states will say, okay, we're going to accept lock, stock, and barrel the CDC guidelines. And at that point, then the state dental board can be the enforcer. And that can lead to things where they can give you warnings. They can do an inspection if they've had a complaint from either an employee or unfortunately an ex-employee or a patient. They are mandated to come in and just do an inspection. So that's run by the state. So I'm kind of embarrassed to tell you, only 38 states out of the 50 have totally adopted CDC guidelines. So it's kind of the Wild West for the rest of them that are out there. They can pick and choose their own. Rather than adopting CDC, they will pick their own state guidelines. So what I always tell everybody, wherever you are, whatever state, whatever area that you work in, please make sure that you are aware and you are confident that you are maintaining all of the rules and regulations, not only for your state, but for your local area. It may vary from place to place. So always important to kind of know where you are and know what is expected of you, just to make sure that everything is compliant and everybody's happy.
But the best way is always to follow the highest protocols and recommendations. So that way you're sure of being okay.
Indeed.
So of course, unpacked instruments are completely exposed to the environment as soon as the sterilizer door is open, may be contaminated by dust, aerosols, improper handling, or by contact with contaminated surfaces. When we talk about infection control these days, we only talk about aerosols, but don't forget that infection control is, the goal is to reduce the dose of microorganisms to be shared between patients and contaminated surfaces. So cleaning surfaces is still a very, very important step. Never forget those aseptic techniques that you have learned and that you've all been using for many years. So we have to remind ourselves that those aseptic techniques and protocols have not changed. So for wrapping, we're recommending using pull-out surfaces because it frees up counter space. It also allows to quickly place the cassette or instrument out of sight if there's a need to quickly go back to one of the treatment room, which we know can happen. Prior to wrapping, you need to wash your hands and put on a new pair of gloves. This is following CDC recommendations. Of course, arrange instruments in functional sets to use on a single patient. And like we said earlier, make sure that the instruments are clean and dry before you wrap them. Mark each package with the date and time and charging code as per your state regulations. And use biological indicator or type 5 integrator. And I was talking with Doug earlier about that, and I'd like him to share with you this type 5 integrator recommendation that he has for you.
Yeah, sure. Let me clarify also on that last point, use a biological indicator or type 5 integrator. Unfortunately, we don't have the or as an option. You are always going to be required, even in the states that don't adopt CDC guidelines, to do a biological indicator. If they go by the CDC guidelines, it's once a week. Once a week for every sterilizer that you have, you're going to have to run a BI. Two different types of BIs. A BI you can run internally with an incubator in your own office, or you can send them out to be done with an outside surface or service, and they just report back to you. So the issue with that, even if we have a BI that you're running in your own office, the incubators, 3M's got some fast ones now, but incubators for the most part are going to be anywhere from 10 hours to 24 hours. So here's my issue. So if you are running a practice and everything has always been fine, but this one Thursday comes up and you do your Thursdays is your day to do the BI. So the following day you're in the office on Friday and you find out from the incubator, we had a failure. Well, CDC basically says, well, in order to verify a failure, we need to do 2 BIs back to back. So hopefully you have Saturday hours, you do another BI, and then if that case you have another failure, then you isolate the instruments that you can, and you take that machine out of service. Well, here is the issue. How many cycles have you run now that you may or may not have to send letters to those patients who may or may not have participated in some of those instruments, and basically send them a letter saying, well, we're not so sure that the instruments we used on you were sterile, so at our expense, we're going to ask you to go and have some blood work done just to make sure that there has been no disease transfer that has been caused by our little issue with the sterilizer. Here's what I recommend. There are things called type 5 integrators, and it's like a strip. Actually, there's one on the right-hand side there. Down on the bottom of the page. So what it is there's going to be, and some of them have green, others have blue. It's a kind of a waxy substance. And if you look on the back of these things, it looks like a thermometer. And what happens is it does multiple parameters. It checks for time, it checks for temperature, it checks for steam. It checks basically almost everything that you're going to need to prove that you've had a successful sterilization cycle. So what I recommend is just take a regular pouch, put one of these type 5 integrators in that pouch, seal it. Now you make it a challenge device. And what I recommend is put that in the middle, whether you're doing pouches or cassettes, put that in the middle of the load of whatever sterilizer you're using, and then use that, in my vernacular, use that as a load release indicator. So whoever is tending to the sterilization area, they open up after the cycle, after the machine says we're done, you open up the door, and then you reach in and you pull out this integrator and you take a look. And now, whether it's green or blue, it'll see from the left here, it'll go all the way over to the right. And when it passes that green portion, I call that the goalpost. It doesn't have to go all the way to the right. It just has to pass into the green. Once you're there, you have had a successful cycle. Well, here's the deal. So now you're doing that, one of these in every cycle that you run. And on that same Thursday, you're going to run your BI later on that day, but all of a sudden you run this and it fails. Here's what I would do. I would take another integrator, another type 5 integrator, put it in another pouch, seal it. Don't move any of those instruments that are on the inside. Run it again. If by chance you have 2 failures in a row, I'm fairly confident that even if your machine's not giving you any error codes, you have an issue. I would isolate those equipment, that dental instruments on the inside, and contact your dealer and tell them, hopefully you have another sterilizer in the office that you can use as a backup to continue on. But in a case like this, now here's the nice part. What exposure do you have should that machine, be non-functional? 0. Because you never release that load on the inside. At the end of that cycle, whoops, I had an issue. Let's do it again. And if you have 2 in a row, isolate everything you in there and call in the cavalry from the dealers, because you have something that you have to attend to. The nice part is, versus a biological indicator, how many cycles have you run before you really realize that, I may be having a problem with this sterilizer, versus doing this. Now, when I tell people this in lectures, I get the hands up and they say, well, am I required to do this? No, you're not. Will I get in trouble for not doing this? No, you're not. However, what less expensive insurance policy would you have? Each and every cycle what the machine is doing. And at the end of that cycle, you know exactly what's going on. And to Annie's point, you're still going to have to do a BI, but this doesn't take the place of a BI. So you're still going to have to do your BIs, but this will give you a indication each and every cycle, not relying on the machine itself to say, okay, good to go, and we're relying on the technology of the machine. This just gives you a positive yes or no at the end of the cycle, and you have 0 exposure. So I recommend doing that. Thank you, Amy.
It's a reassurance. So good advice. Thanks, Doug. So of course, after wrapping, the obvious next step is sterilization. So use the autoclave, use the sputum, use any types of equipment you have. we are always recommending to temporarily stack wrap instruments waiting to be sterilized on some supports right next to the autoclave. So that way, when the assistant passes in front of the Steri Center, they have a visual reminder that some instruments are ready to be autoclaved. Because we know that the volume of the autoclave has a certain limit. So we don't want to overstock, do not overfill those chambers, but you want to know that you have instruments waiting to be autoclaved. So of course, Doug knows a lot about autoclaves. Would you like to add something more specifically to that step, Doug?
Yeah, sure. When we are dealing with, and a lot of Annie's pictures have been of offices utilizing cassettes, the beautiful thing about cassettes, not only from an organizational standpoint, but our friends at Hugh Freedy will always tell us, I know oftentimes in the field, when we're talking about this to dental offices, look, Annie and I don't have any skin in the game. We don't sell cassettes. So when we're pushing cassettes, it's because it is the easiest and the quickest and the most effective way of running the sterilization. We don't make a penny for people buying cassettes. But what I can tell you is that through the studies that our friends at Hugh Freedy have done, you can basically cut off 5 minutes per patient just by using cassettes. So once we kind of have the generalization that cassettes are a good thing to do, the nice thing about anybody's sterilizer, you can't really overload a sterilizer with cassettes as long as you keep the cassettes in the racks. Now, I've had some people with anybody's sterilizer, they'll take all the racks out, they'll have the bottom shelf, and they'll just stack them, like 5, 6, 7 of them up. Well, that's a no-go. You can't really do that. But if you keep the cassettes in the rack, it's impossible to overload a sterilizer. Whereas with pouches, we've seen some pretty stacked pouches where there are sterilizers where they're just cramming all the pouches in that they can. And to Annie's point, making sure we have area around so the steam can get to it. In the drying phase, make sure we can get them nice and dry. So when they come out of the sterilizer, everything is nice and dry.
So Doug, there's someone having a question asking, what do you use to write on the packages?
We don't recommend using pencils or pens because being a sterilizer company, what happens is that tends to bleed and leach out during the sterilization cycle with the steam. And over a period of time, you have a really fugly looking sterilization chamber. It starts to get brown or black, and all it is, it's the ink and the pencil, the graphite, coming off of the bags and attaching itself to the inside. Now, you can rigorously clean the inside of your chamber on a regular basis, or just purchase there are instruments, SPS, medical, I'm pretty sure Hugh Freedy and some of the others, we don't, but there are pens that are specifically made for sterilizers that won't leach and won't bleed. We recommend using those guys.
Would you recommend writing on the package after the sterilization?
No.
If you don't have the correct pen?
Yeah, I would do it beforehand, because what happens is you're going to put, the information of what the sterilizer is, what the time is, and, rather than, because maybe if a different staff member comes in and is emptying the sterilizer versus that loaded it up, just too many easy ways to make a mistake. So whoever's putting them in, or actually, right when they're packaging, just a real brief little notation as to what the date is, which sterilizer this is, and maybe the time of day is going to be really nice. Now, I did mention that if we had the type 5s, we're not really going to have to go backwards and say, okay, well, now we're going to have to go back and find packages over this period of time. I'm not worried about that with that kind of process, but still the rules and the regulations say that, yeah, you should be marking the packages. So we have to relent to what the rules say. So yeah, they do say that we need them identified. Now, some of the higher tech and lots of companies are either have them now or will be coming out with. It's all integrated with your patient software. It'll print out a little tag, and those can be affixed to either a cassette, the outside of a cassette, or affixed to a pouch, and it will identify everything that you need done, and it's just kind of automated. So a little bit early for some of the companies, but believe me, it's coming.
Thank you. So of course, after being sterilized, you need to store those clean instruments. Sorry, now it had to happen. My PowerPoint has decided to freeze. So next step is, like I said, storage. So clean storage, of course, to protect instrument from contamination. Again, centrally located. And instrument, oops, sorry, it kind of decided to unfreeze at. So instrument must ideally cool down to room temperature prior being removed from the autoclave and stored. The storage area should be dry, dust-free, away from heat, sink, or direct sunlight. Adopt a first in, first out system of stock rotation and keep sterilized items wrapped until use. And make sure not to stack cassettes on top of each other. So there are some storage out there where the only thing you have are shelves, or where you have like wire mesh baskets. So you have to stack them. This is not ideal because we want to keep those instruments dry. We want to remove excess moisture that may be there from after the sterilization area.
Annie, let me interject also right while you have that up. One of my biggest bugaboos is with ultrasonic cleaners. I can't tell you over the years, and there's been a lot that I've been in the business, but I can't tell you over the years how many offices, nice, pretty, clean offices that are, the staff seems to be up to speed on everything, and you walk back in the sterilization center and there's no lid on the ultrasonic cleaner. And the traditional question is, oh, where's the lid? If they come back to me and they say, I don't know, that tells me this is not just the first time this has occurred. This is an everyday type of protocol. So what happens when you don't have a lid on an ultrasonic cleaner, you have this thing spewing atomized, anything from blood to whatever the stuff is in that ultrasonic cleaner. And to Annie's point, where we're talking about making sure that packages and pouches are dry, when we talk about putting a wet pouch on a contaminated area, well, here we go. If we have a ultrasonic without a lid on, then I'm spewing up to 15 feet away this aerosolization of this crap that's inside the tank. And if I have a wet pouch, so the membrane on the pouch is permeable, and I lay that down on a countertop of a sterilization center operating with a ultrasonic with the lid off, we've screwed the pooch right then and there. We've done everything perfectly, but then I've taken a wet, porous membrane on a bag and I've laid it on a contaminated surface, and we have a really good potential of undoing all the good work that we have already done. So please, please, please make sure in all of your own offices, there is never a case where an ultrasonic should be running with the lid off, unless you're doing a foil test. Other than that, I'll give you that. But with instruments, always have. And Annie made a great point talking about ultrasonics. Never shut the cycle down ahead of time. We call that re-inoculation. Here's what happens is a hygienist will be working and she'll be flipping back and forth as she gets her instruments. And then she'll come in and they'll maybe out of a 20-minute cycle, maybe there's 3 or 5 minutes left. She'll open up the lid, throw her instruments in, close the lid and go off. And then 5 minutes later, boop, the machine shuts off and everybody working around said, oh, wow, everything's clean. No. What happens with re-inoculation is the time cycle starts over again anytime dirty instruments are introduced into the cycle. So if she comes in 5 minutes before the end of a 20-minute cycle, crank up the timer, run it for another 20 minutes, because you just can't throw stuff in there, have it be in there for 30 seconds, a minute or 2 minutes, and expect that it's going to do a good job in getting everything clean. So that's one of my bugaboos. A lot of people, when Annie and I both talk about using utility gloves, to be honest with you, a lot of offices just use regular, the latex or whatever gloves that they have now, and they're not going to the utility gloves. I'm not going to draw the line and saying I can show them the error of their ways and they should be doing it. I'm worried about pricks and pokes. and you know, and the safety of the staff members. But I'm not going to draw the line in the sand. With a lid off an ultrasonic cleaner, we'll go to war. I'll make some noise. Sorry, Annie.
Very good point though, Doug. And we're always recommending to have a place for that lid. So in that soiled area, ideally is to have some shelves or support or whatever they are, so you can place the lid upside down to avoid dripping. And at least you have it there, so you never lose it. You never forget to place it back. Because to Doug's point, this is a lot worse than the aerosols created in your patient mount.
Yeah.
And in this case, you cannot have the ultrasonic cleaner rinse with a mount rinse before. It's all in there. So that's pretty obvious. Good point. So this is completing the steps. I hope it was good information for you. Now, I would just like, before we move to the question and answers, to some expected new guidelines or new workflow that we are foreseeing to happen, and that have started to happen in some areas. In some provinces in Canada, it has happened like a year and a half ago. We see that spreading in other states and might spread in some states in the US as well. So in this specific setup, the difference with what you typically see out there is the location of the dental washers or thermal disinfector, which is right in the middle. We always or often see it at the beginning of the cycle on the complete right soiled side. I say right, it could be left, but in this specific case, let's say that it's on the right side. So in here, we're really separating the soiled from the clean. The goal is to avoid, in all cases, to go back to the soiled sink, because prior to wrap and prior to take clean instruments from the clean side, you need to wash your hands and put on new pair of gloves. So if you have only one sink or one hand washing access in that Steri center, it means you will have to use that soiled sink who has been used for scrubbing soiled instruments, washing your utility gloves, and any other soiled procedure. So in this ideal scenario, you would have like a receiving station to manage all the soiled item that you may not have time to manage right away. You have some waste, regulated and non-regulated. Then you have that pre-soaking and lubricating area, which is, as we said earlier, definitely a soiled step. And you have that soiled sink that you will use for scrubbing, for rinsing out of the ultrasonic cleaner, for washing your hands when you're coming from the treatment rooms with soiled instruments. Then you have those dental washers, because this is what separates soiled from clean, because you're soiled when you enter those washers, but you're definitely not sterilized, but you are clean and dry when you're out of those washers. So you're ready to wrap them, but prior to wrap them, you need to wash your hands in a clean sink, get a new pair of gloves. And in some areas, they are requesting a physical barrier between that sink and the wrapping station. It's not a regulation in everywhere, but it is in some areas.
Yeah, let me interject one other thing too. CDC guidelines say you should have a spatial barrier or should have a barrier or a spatial distance. And unfortunately, they don't specify, you know, is it 2 feet, is it 3 feet? We just need to separate the wrapping areas from any kind of dirty aerosolization. And Annie's thing with the 2 sinks here, I mean, I just love this whole idea. Because with a sink, we always want to go from, as Annie said, left to right or right to left, however the room's set up. So if we were in an oral surgery practice, what I would do, I would rinse the instruments to get the worst of the contamination off and then put it in the washer. So if we're doing that, I can see from the dirty area, I have my dirty sink and I take it right there and I put it right into the washer. Whereas so many of these dental centers by other companies who don't get it sometimes, they put the sink in the wrong place, and we're asking staff to pass the washer, rinse everything, and then come backwards again to where the washer is. This is a perfect layout. So we're going to rinse if we need to. We're going to rinse, put it in the washer, and then move it from the washer to the dry wrapping area, and then on to sterilization. Sorry, Annie, this is a very, very great presentation with the two sinks. I love it.
Yeah, of course, here we're showing two smaller dental washers. The same setup would work with a larger dental washers, but the location of that dental washer should be like the separation between the soiled and the clean. And of course, this means you need more space, but I think that we can also think about a more compact version, where instead of having a clean sink, which we all agree is the ideal scenario, but if you integrate Purell gloves right above the wrapping station, then at least you provide a possibility of wash your hands without water, of course, but CDC recognized that Purell, or they call it, not Purell, but there's another word for it, but it is
alcohol-based cleaners, yeah.
Yes, alcohol-based. So it is recognized as an okay procedure if your hands are not visibly soiled. So if you use Purell gloves prior to wrap, then at least you haven't gone back to that soiled sink. So this completes the presentation today. And now we can move to the question answers if there is any. And I welcome back Brent.
Hey, thanks for having me. That was fantastic. I knew everybody would be in for a treat, because you two are probably the best in the business, at least in all of North America, that's for sure. So a lot of great questions have come in. It looks like we got 6 or 7. If people can hold tight for a couple of questions, and then what we'll do is we'll post the CE for everybody so that they can link to that as well. So you have the screen up here, and it looks like, there's a distance measurement at the bottom there, which is obviously dictated by the setup that you have. So someone asked if there's any sort of formula or anything, equation that is centered around maybe the number of operatories that you have. Does that get translated over to sterilization, or is that really independent of that?
Let me give a stab on that, Brent. Oftentimes it's actually kind of fun, because it's all math. When we work for some of these ortho offices, it's amazing. You're at the ortho meeting, the national ortho meeting, and we have offices that come into our booth, and you just ask them, how many patients do you see a day? And they're very flippant about it. They go, I don't know, 150. And I go, a day? And they go, yeah, that's our standard day. Now, obviously, in an ortho office, doctors are not seeing every patient. They're having wire adjustments, and advanced staff members are taking care of that. But still, you're going to have that many dirty instruments. So whether it's working with our friends at Hugh Freedy, or working with, if you have an existing practice, my biggest thing is, how much gear are you running through in the morning? And how much gear are you running through in the afternoon? If it's cassettes, let's count cassettes. If it's pouches, let's count pouches. So now we have a fixed amount that sterilizers can do. One of the big sterilizers on the market only can take 4 full-size cassettes on the in the inside. And if you're seeing a boatload of patients, okay, well, you can have a washer, and in a washer, you can get 10 of those full-size cassettes out in 40 minutes. But now look what you got. You've got a backlog, because your one sterilizer can only do 4 at a time, and it's approximately an hour and 6-minute long cycle. So when we're doing the math based on not necessarily just operatories, but based on the busyness of the office, let's get a count, and then we just start with the sterilizers and work backwards. here's how many we have to do in the morning. Here's how many we have to do in the afternoon. Do I need multiple sterilizers? Do I need a different kind of sterilizer? And then the washer is the same. We can work backwards from the washer simply because now we know what kind of gear we got going in. And we can say, okay, in some ortho offices, there may be 2 large side-by-side washers in one of these 150 a day type thing, because you got to keep the gear moving through the system so people aren't waiting to set up the next trays for the new patients because I don't have any instruments. I'm out of instruments. You got to keep it rocking and rolling. So it's not so much operatories, how many operatories, it's what kind of gear you're running through there, and then just do the math backwards. Ask your dental folks to help you do the math, but it's relatively easy to do, and we can usually be pretty well spot on.
Perfect, perfect, Doug. So I can see that we had some audio issues because someone had reported that there were some audio issues when Annie was finishing up on her presentation regarding some of the new things that are coming. And hopefully Annie's gonna be able to join us back here. But hey, we got Doug is back up here for answering some questions for us. So if Annie joins us back, that'll be fantastic. So Doug, you're on your own here for some Q&A, but I know you've been doing this a long time, so nothing's surprised you.
You got it. What you got?
All right, so we got quite a few questions are coming in. So if people don't mind sticking around a little bit longer here for some questions, and then I'll post that CE. Let's look here and go through them here. How much time should the instruments be put through an ultrasonic? Is that going to be dependent on the chemical that they're using, or what's going to?
We taught you well, brother. Yes, that's exactly it. The machine doesn't dictate the time; it's the chemistry that you're using. Some chemistries will take. It'll say on the site. It'll say on the label your IFUs for that says 20 minutes. There are other chemistries out there that are 5 minutes. So, and then again, it doesn't make any difference what the ultrasonic cleaner is. The time in the ultrasonic is always run by the chemistry that you use.
Okay, perfect, perfect. And then, so how often should you change that solution? That's a perfect question from Carol.
Yeah.
Some solutions say they are active for 30 days. Is it safe to wait 30 days before you change the solution? Are there any indicators to test the solution? What can you tell us about that?
You almost kind of made me throw up in my mouth when you talk about 30 days. Our deal is in busy offices. Now, if it's a semi-retired lady or gentleman and you're seeing 3 patients in the morning and 3 patients in the afternoon, not a big deal. However, if you have a thumping office, not the big ortho ones, but you have a thumping office, just busy all morning, busy in the afternoon, the rule of thumb is you change the solution when it starts to become cloudy or dirty. And that can very easily be, you're going to change it basically twice a day. You're going to change it at noon, and then you're going to change it at the end of the day to be ready for the next day. To even contemplate in a busy office, leaving a solution in for 30 days, you will have germs the size of turtles by the time that time is over. So now I wouldn't recommend that.
Well, there's a couple other questions here that are centered around what's going on in their existing offices. So I'm glad I'm not disclosing those.
I'll tell you what, to vamp what we're going to be doing next week, next Friday at, help me out, Brent.
12 noon Central.
12 noon Central time. I'm going to be talking about not only we're just going to kind of reinforce some of the things that Annie was talking about, but even more important, what can you do in your existing practice? We'll have some horror story pictures, and hopefully nobody attending is going to put his hand up and say, hey, that's my office. But anyway, one of these days I'm going to run across somebody that I'm showing these pictures, and it'll be somebody's office who's attending. But what we can do is, what we're planning on showing is, again, reinforcing what the proper sequence is. And then let's take a look at a couple of these existing offices and how can we turn this around? How can we make it more effective? How can we make it more optimized from a time standpoint? How can we make it more optimized from a standpoint of CDC guidelines? Can we make it compliant, even though it might be a kind of a horror story now? That's the time when you start to call some of the experts in saying, here's what I got. What can we do to help? And there's oftentimes things that we can do to help.
Right, right. No, that's great advice, and going to the experts. That's what the experts in the field are for. The specialists and all that. So it looks like Annie came back. We got a little echo there, so Looks like you went from Canada to looks like San Francisco. That was a long trip.
Yeah.
So welcome back, Annie. Hey, just to bring up the speed, we just hit a few questions there. Doug is been doing fantastic here. And we were talking about the topic of, staff and what they see going on in the back room in the sterilization area. So one person had asked about, they often place the instruments in the ultrasonic, and Doug, you talked about, start to finish, right? Don't interrupt the ultrasonic.
Right.
So
Right.
their question is this an interruption? Is they place the instrument into the ultrasonic, they start the timer, they walk away, and then they come around the corner and they see a hygienist walk in and drop her instruments in halfway through. Now, I mean, he dropped his instruments in there, so I'm sure it was one of the male hygienists that did that, but she's like, hey, not to tattletale, but is that right or wrong, Doug?
Well, definitely wrong. It's just what I was talking about re-inoculation. When you put dirty instruments into a running cycle, that is considered the beginning of the cycle again. So what you would do is you would put your instruments in if you see the hygienist, and it's okay that she does that, but what she's going to have to do is reset the timer for the entire cycle if you put dirty instruments in midway through a cycle.
Okay.
Then you're good.
Let's see here, because I just got messed up on my screen here. So this person also, well, it's a different person, I'm sorry, attempted at an office, and they had instrument cassettes were ran through, plug your ears, Doug, they ran it through a regular dishwasher before putting it in an autoclave. Is that okay? I mean, what's that all about?
Well, what we're looking for, whether it's a sterilizer or some kind of device that's going to clean your instruments, we're looking for an FDA cleared device. And clearly a washing machine is not going to do that. I have a number of things, and Brent can probably cycle this chapter and verse as to what I'm going to say. But when you have a regular dishwasher, at least the one, I have a really nice dishwasher here at the house, and cycle time, because I run sanitation cycle, go figure, a bug guy. I run sanitation cycle all the time. It's a 2-hour cycle. 2 hours in a dental office is not helping you process instruments through the system. So, and the other thing is, if you go and you buy a really good Sears machine and you have it delivered, if you're talking to the Sears guy, here's what this conversation is going to be. Say, oh, Dr. Brenly, thank you for coming in. We'll be happy to bring this to your dental office and install it in your kitchen. No, I want you to install it in my sterilization area. Next words out of that salesman's mouth should be, well, Dr. Brenly, we'll be happy to do that for you, but now you're voiding the warranty. So if it breaks later on tomorrow afternoon, we're not going to, because you're using it out of the focus where this thing is supposed to be run. So there is no warranty. And our friends at Hugh Freedy will void the warranty on cassettes and instruments if you're using what they'll call a commercial washer, or let's call it a regular washer. The other point I have is, what soap do you use? I mean, Cascade is not what you're going to use to make sure that dental instruments are good to go. And the other issue is that when we have cassettes, I mean, a regular dishwasher has plates, and think about a plate. Plate's going to go in straight up and down, whereas a cassette, we got to get inside. So we found in a lot of them, like 21.3 degrees is the perfect tilt, because the washer arm is going to come from below, the washer arm is going to come above. But if I have cassettes put in, to plate holders like this and this, how on earth am I getting into the middle of these cassettes? Because I got a swing arm coming around the top, a swing arm coming around the bottom. It ain't gonna work.
Right. Yeah, that makes sense.
Yep.
Since Annie crossed over to San Francisco for us to come back, which we appreciate, I've got to throw a question her way. And so if everybody doesn't know this, I mean, Annie is probably the premier designer of sterilization in all of North America. I mean, she's been doing this since she was this tall, and
20 years already.
Yeah, exactly. And so, I mean, your company invented the Steri-Center, right? It's like Kleenex, right? That when someone says Steri-Center, they're talking about you, which is really cool. So you know a lot about this. Your design, I noticed, is like pure. It's white, right? I see sterilization all over the place. It's wood grains and colors and can you tell us about why your stuff's all white and clean? Why is that?
Well, visually, sterilization area used to be at the back of a clinic in the last room, an L shape or U shape with equipment placed on countertops. So patients were not necessarily seeing that backstage room. It was like the technical room. Since we came out with that Series Center with the red and blue doors, it became a statement from the clinic to the patient to show the patient how important infection control and instruments sterilization is for the dental team. So showing off this sterilization area started to bring important of cleanliness. And of course, cleanliness is mostly white. We do a little bit of other colors because sometimes there are designers involved that are requesting some specific homey feeling. We see that less and less in today's world. People are really, really more into the clean white look, because what is white? You can feel it's clean because you could see anything that you would need to clean on it. So it's kind of an obvious clean choice, I would say.
Right. No, that makes sense to me. And there's a question from one of the attendees. Unfortunately, I don't want this to turn into a commercial because this is for CE, but they're asking for, what are some of your favorite companies that manufacture Steri centers? Well, she mentioned Steri Center, so there's only one, right? So obviously Annie's the premier in the world for sterilization. So if you're looking for a solution for a design, they can do something for you and get you something designed easily. You can talk with your dental dealer about other options that might be available to you. But I mean, these are the experts right here that can help you the most. So take advantage of them while you can. So hopefully that answered that question without crossing over the product line sort of thing that goes on with CEs. We're just trying to do things the right way. So this one here from Lisa, when it comes to fogging a room, should you fog before you wipe or after? So is that?
Yeah, I'm not a fan because oftentimes it's that new acid that they're talking about for fogging, and we sell a particular chemical that actually will have an opportunity, depending on what the pH is in the room, to actually turn it into hypochlorous acid. So yeah, what we're looking for is mechanical cleaning in order to get a surface clean. So that's why we're either using a spray with a Seafold towel or 4x4s, or you're using a wipe. So not only are we putting the chemicals down, but we're mechanically helping to clean that off. Whereas just misting and fogging, it has to get around corners, around handles, and it is just a little bit difficult. We had our good friend, Dr. John Molinari. I was asking him about fogging, and when he was at the dental advisor, they have a dental clinic there. This is some years ago, they were experimenting with a fogging machine, and the staff was complaining about everything kind of being sticky, and because the fogging machine was kind of leaving a little bit of a surface. So I know everybody's trying to do the best that they can, but just a personal vein, I'm not a fan of foggers.
I appreciate that. And then it looks like we have one more question. It's probably going to be pretty open-ended, so I thought I'd save it for last. Before we answer this last question, we've completed the CE, and if you've noticed under the chat section, I did post the link for the CE, so feel free that you can click on there and go through that process of getting your 1 CE. And then if you need a course code, it is code 148 for the AGD. That's code 148. The link is under chat. So the last question is more of a question / statement. I'll kind of interpret it here for you. As far as, like, you had mentioned something about, Doug, I think it was this new practice management in the digital world, to be able to print something out and use that for sterilization, that it's coming. Is that something that you can share with the audience right now, or how can they learn about that? Do they keep an eye out for a company like yours that's the experts that
Yeah,
That sort of
you know,
stuff?
at best to check with the dealers, because right now, you know, again, not making this a commercial, some sterilizers that I know very well have the ability with some software to, they're going to run that all, and they're going to give you a printout of every cycle that happens. So if you had a failure, if you had a good clean cycle, it will do all of that automatically for you, and you don't have to do anything to it. There's also some barcoding coming up in the near future where you can just scan, and this would be in your practice management software. You would scan, like say, an instrument set, and when you scan it in, it will identify it as to the day, the machine, and everything, and it'll just put a barcode on it. And then at any time later on, you can always read that barcode and you'll know exactly what's going on with it. Dental schools do that just to kind of keep those slippery dental students from walking away with cassettes and stuff, because they'll turn in, if they're working in a pedo clinic, they'll say, okay, I'm doing a deciduous tooth, I'm doing this particular one. So they'll get a set of instruments and that gets scanned. So not only is it scanned for the patient, it's scanned for the doctor who's using it. And then when they turn it back in, they'll check and make sure all the instruments are in, scan it. And if there's something missing or something awry, then they can go back to the operating doctor and say, hey, we gave you a full cassette. I'm missing 2 instruments now. So it's just a way of keeping track of the stuff that you use, and it's done automatically. Now, is anybody doing that rampantly right now? On the medical side, they certainly are, and it is coming within the next year for a lot of us on the dental side. So stay tuned.
Perfect, perfect. Well, that kind of leads to that finishing question. That's what I was going to ask you about. Maybe there's some other things that Annie may want to share with those that are inquisitive about. I mean, Doug, you talked about ensuring, you know, through the type 5 indicators,
Yep.
integrators, which deals with risk mitigation, right? So that's a fabulous manual way to do it. It sounds like you described some electronic, you know, more digital ways of autoclaves, kind of like letting you know something's happened, print out reports. Anything going on, Annie, in the world of sterilization, risk mitigation for infection control from dental units to sterilization? Is there stuff in the world going on that many don't know about that they could take advantage of, that manages that sort of stuff?
Yeah, sure there is, and there will be more and more coming, as Doug was mentioning. But there are some companies having like embedded tracking tags embedded in instruments or add on existing instruments. And then with different RFID readers, for example, you can track the inventory, but you can also track out of the sterilizers and inside the clinic. We can even think about tracking those instruments as far as the patient mouth. So this is coming in the industry. Some schools are using this technology today, and they're gathering data, and they're gathering out a lot of tracking of those instruments, and they're linking those instruments to the users and also the patients. So it is definitely coming in the dental industry.
That's awesome. Awesome. So speaking of awesome, you two are fabulous. I knew everyone would be excited. Everyone stood around and stuck around for the whole night. We didn't lose anybody. We had some great questions from the audience. We had some technical audio difficulties, but we got through them, and you made a trip to San Francisco to make it happen. So we
yes, that's why I had to cut off.
And so long journey home tonight. So for you, so we'll probably let you go, but we really, really appreciate it. And everyone should have their CE next Friday, June 26th, 12 noon Central. These two will be back. Doug is going to spearhead a little bit with Annie support to kind of go over some sterilization areas that maybe you have in your existing office. Maybe you want to do some tweaks and some modifications. So Doug and Annie will be back to help you with that. And I will also share with you, if you're ever back out in the real world at these live trade shows, or if you're on Zoom and you're looking for these two, but if you're live and you have a chance to stop by and see Annie, to talk about sterilization, she's the best in the business. And right next to her is Doug Brenly, who's by far the best in infection control. And those two love to help. So stop by their booth, SciCam booth, stop by the Plan Mecca booth, say hello to both of them. when you get a chance, because they're a wealth of knowledge, and we appreciate you taking the time to be here tonight. So thank you very much. Everybody enjoy the night, and we'll see you back at planmecca.com.
Thank you. Appreciate it.